to my channel. It's your favorite doctor. It's Dr. Randy Lample, aka Dr. Motivation. It's another episode of Woman Crush Wednesday. Thank you so much to those of you who joined us in our last episode. It was absolutely amazing. We did so well. We got above 70% average in our quiz that we did last week. That was fantastic. I think we can all give ourselves a round of applause. For those of you who are joining us for the first time, welcome, welcome, welcome. Please remember that you need to watch the first video in order to watch this video. We're building on our anatomy, so in order for you to understand what we're talking about here, you need to know what went on there. But without further ado, let's get into the topic of the day. And today, red fire hot. Can you guys guess what I'm talking about today? Yes, we're talking about the red robot. We're talking about menstruation. We're talking about periods. So I'm going to explain to you guys why you go on your period, what happens inside your body when you're going on your period, and then we're going to go through a few devices that we use when we are on our periods. I completely understand that there are a lot of abnormal things that happen in periods and a lot of things that maybe we are not so comfortable with, but this particular video will be focusing on a normal period. In a later video, we're going to talk about all the things that happen in between, the pain, the bloating, the heavy menstruation, etc., etc. So let's get back to our anatomy. Let's get back to the drawing, okay? So here's what happens. Remember we spoke about the ovaries. The ovaries are over here. I'm struggling to see my own shirt. There's the ovaries, right? So remember we said that the ovary is like the big egg, right? So your menstruation is a day from day 1 to day 28. That's like the perfect menstrual cycle, day 1 to day 28, right? So this little ovary over here has a whole lot of little eggs on the inside, basically. And so what happens is your body releases some hormones, and what these hormones do is they let one egg mature. So they select one perfect little egg, and that egg matures. And so what your body then does is it releases that egg. When your body releases that egg, remember our little tube, our fallopian tube, collects the egg, and then the egg comes and the egg chills inside the tube, right? While the egg is chilling inside the tube, it's waiting for sperm. So if sperm comes in from the vagina, the sperm comes up, and then it will meet the egg, and then we're having a baby, okay? But we're not talking about having a baby, so I'm going to tell you what happens when you don't meet the sperm, right? So now you've released this egg, that is day 14. Remember we said it's a day 1 to day 28 cycle. So on day 14, your body releases the egg. The egg is chilling inside the tube, and then it chills there for about 12 to 24 hours. It's waiting for sperm. There's no sperm, so now this egg has to be released. It needs to be dissolved because there's no fertilization that's taking place. So why are you releasing an egg? Your body is releasing an egg because it wants to fall pregnant. So in that process of wanting to fall pregnant and preparing for the pregnancy, the wall of your endometrium, so this is your uterus. Remember we said this is where the baby will be incubated for 9 months. So inside your uterus, you've got different layers. You can see that the walls are quite different. You've got different layers of walls. So the most inside wall is called the endometrium. So when you've released this egg, this endometrium starts to become thick. It starts to bulk up. It starts to prepare so that it can carry this baby for 9 months. So in that process that's happening, the egg is chilling over there. Then your body realizes there's no sperm this month. So what must we do? The egg needs to dissolve, and we need to shed away this thickened wall because we don't need the wall. We don't have the baby that we're carrying. So in the process of releasing this endometrium, what happens is you need to bleed. So the blood sheds, and then you're bleeding. You're bleeding. So the bleeding is from day 1 to day 4 of your cycle. That's menstruation. The rest of the cycle from day 4 to day 14, you're preparing this egg. On day 14, you release the egg. And then from day 14 up till you get to day 1 again, essentially that whole process that I just described is happening. So what have we learned here? We've essentially learned that our body wants to fall pregnant every month. Isn't that like madness? Absolute madness. So your body tries to fall pregnant every month, and when you don't fall pregnant, it needs to release that wall. and that is why we bleed, and that is the process of menstruation, or having your periods, as it's better known as. All right, so you need to have a good relationship with your period, especially if you're someone who's trying to fall pregnant. A good, healthy period means that you can conceive and you can fall pregnant. So when you're looking at your period, there are 4 things that you need to pay attention to, right? You need to pay attention to the flow, the frequency, the duration, as well as the volume. So what do these things mean? So the duration of your period should be around 4 to 8 days. We recognize that there are a number of you who have a 3-day period that can also be healthy, but based on the literature and what has been studied over time, we found that 4 days to 8 days are the number of days that you should be bleeding. Beyond 8 days is a little bit extensive, right? And then the period, or the time period rather, between each period should be between 28 to 35 days. Some literature says 38 days. So if your period is less than 28 days apart, so every 20 days you're bleeding, that is too frequent. That is not normal. If your period is more than 38 or 35 days apart, that is too far apart. That also is not normal. In terms of the volume, right, they say that your period should be between 5 to 80 milliliters. Let's just have a moment of silence, because how on earth are you going to measure your period, especially from a pad or a tampon? It's very difficult to tell how much you are bleeding. But according to the literature, it's 5 to 80 mils. And if you think about 80 mils, it's really not that bad. I think sometimes we're on our period and we feel like we're bleeding for like Africa. You feel like, oh my word, like you're losing all the blood in your body. It's so hectic. But it's actually only 80 mils. It's actually not that much. Like, it's really not that much. And then another thing is that you need to be having your period every 28 to 35 days. So if you're not having a period, you should have 12 periods in a year, essentially. So if you have, maybe in 2 months you have 1 period, that's a problem. That's not normal. If in 6 months you're not bleeding and then you bleed regularly the next 6 months, that's not normal either. Please be advised that if you are on contraception or any kind of medication that can affect your period, you are in a completely different group, and your period might not be the normal period that we usually expect. All right, guys, so that's part 1 of the topic. Now we're going to go into the different devices that we use. We have a very interesting device today called the Menstrual Cup that I will go through with you guys, and I really want you guys to engage and tell me what you know about the Menstrual Cup, and how is it that you've used the Menstrual Cup, and how has it affected your period up to now. All right, so these are the different devices that we'll be looking at. On this side, we've got a panty liner. Here we have a pad or a sanitary towel. Here we have tampons. And here we have the infamous Menstrual Cup. So I'll start on this side with the panty liner. So this is what the panty liner looks like, all right? They come in scented and unscented flavors from different brands. And basically, it's also got a strip at the back. You basically just remove the strip, and then you stick the strip on your underwear, and it just captivates, or captures rather, all your discharge and all the bleeding, like at the end of your period, when you're not bleeding heavily anymore, you're just spotting. So remember that the shape of this, the shape tells you where you need to apply it. So this part, which is big and broad, will be in front, and the part that's tiny will be going towards your anus or towards your bum hole. All right, so that is your first device. Your second device, you've got a pad or a sanitary towel. So these are the ones that I like, because these ones literally have wings that help secure it in place. Again, you need to look at the shape. The funny thing is that, remember when we spoke about this, we said that the broad side goes in the front and then the smaller side goes at the back. It's actually the opposite with this one. With the pad, you make sure that the smaller side goes in front towards the vagina, or the vulva rather, and then the broad round side goes towards the back, towards the bum hole. Okay, so it's the same as the other one, where at the back you have the strip. You remove your strip and you stick this on your underwear, and then you remove the wings, and the wings basically enclose your underwear to keep it in place. Now, it's very important that you choose the correct pad size for whatever it is that you're going through in your time of menstruation. So some people have very heavy flows. This is an extra long pad. It's a thick pad. It's a pad for somebody with heavy flow. If you have a very light flow, there's no need for you to be walking around with all this baggage, because a smaller pad will do just the job for you. So this is amazing, because what it does is, I don't want to waste a pad because we know that we have a shortage of pads in the country. But what it does is it basically captures and it locks all the blood. However, I think as women, we know that sometimes there's spillage involved with being on your period. So you need to focus. You need to focus. If you put one pad and you find that you are leaking through one pad, what I normally advise people to do is to put two pads. So instead of just using this one, you take this one, you stick it in front of the underwear, you take another pad exactly like this and you stick it towards the back at the back. It's a lot. You're going to be wearing a whole lot of pad, but it will help you and you will feel more secure. The problem with pads is that if the pad is full and you sit on the pad, literally the blood will seep out of the pad onto your underwear, onto your pants, and onto whichever surface you're sitting on. So it's important that you change your pads regularly. I can't tell you exactly how many hours you should keep your pad on for. It depends on your flow. Those of you who have a heavy flow will need to change your pad more regularly than those who have a light flow. So that is the pad. And you know, when you're throwing your pad away, you just roll it, rolly. And then you put it back in the bag and you dispose the pad. We love pads. We think pads are great, especially when you're sleeping. It's comfortable. You don't need to worry. You put it on there, and if you have a good pad, it will capture all the blood. Right, then we move towards tampons, right? So tampons are not really easy to insert. As you know, there are some tampons which even come with applicators, which just tells you about the level of difficulty for insertion of the tampon, right? If you look at this tampon, this particular tampon is a heavy flow tampon. It's a super. They also come in different sizes. So you also have really tiny ones, especially for those of you who have minimal flow. You don't need to walk around with this huge device inside your vagina. If you remember from the first video we said that the vagina is muscular, so it can stretch. So you shouldn't really worry. The tampon should be able to get in there with no problems. However, I myself had some problems inserting the tampon. I actually only learned how to insert a tampon this year at my big age. So that tells you how difficult this can be. So if you're struggling to insert a tampon, do not stress, do not panic. It's actually normal. So something that they don't tell you about tampons, which I think I also only realized after I used tampons for the first time, is that this is what happens after you put the tampon on. This is the tampon before it goes into your vagina. It goes into your vagina. You bleeding, living your best life. And this is what it looks like when it comes out. What that means is, if you struggled, this is what it looks like when it comes out. I hope you guys can see that clearly. What that means is that if you struggle to insert the tampon, you are definitely going to struggle to take it out, because it's like 4 times its size when it's coming out. So you need to be aware of that, and you need to be mentally prepared to pull this outside of your vagina. All right. So I just want to demonstrate for you guys quickly how you insert a tampon. So very, very important. You need to wash your hands. You need to have clean hands before you insert anything inside your vagina. As we know, we do not want to introduce infection inside our vaginas. We do not want to get toxic shock syndrome. So wash your hands adequately before you start. And then you hold your tampon like this. You make sure there's a little twist in the middle. So you just twist it there. Okay. And you make sure that you pull off the bottom half first. You pull off the bottom half, you discard it. And then there will be a string hanging out. You pull out the string. Make sure that the string is hanging, right? Once the string is hanging, you take your hands and you put your hands at the bottom part of the tampon, and you can remove the top part of the tampon, which is now turning against me. But essentially what I'm trying to let you know is that you should be touching this as minimally as possible. Your hand shouldn't be all over this device that's going inside your vagina, because that will cause infection. Now, there are different positions in which you can insert your tampon. You can do it sitting on the toilet seat, you can do it squatting, you can put one leg on the toilet, whatever essentially makes you comfortable. So now I'm going to show you how to insert the tampon. All right, so insertion of the tampon. So remember, we said we've taken off the plastic, the string is hanging freely, and our hands are at the bottom of the device. So you are now in your squatting position. You find the hole in your vulva, which is the vaginal opening. You go into your vagina. You push, push, push. As you push, you're going to start feeling some sort of resistance. When you feel the resistance, you aim your tampon upwards and forwards, because your vagina is not straight, it kind of curves. So you go upwards and forwards, and you push, push, push until your tampon is sitting over there and the string is hanging out. So when you feel at the opening of your vagina, there should be no tampon sticking out there. And the test that you can do to make sure that your tampon is well inserted is you can do a squat. If you do a squat, you should not be feeling any pain. It can be uncomfortable, but there should be no pain. And to remove the tampon, you just pull on the string, and the tampon is out. The last device to review is the menstrual cup. So what is the menstrual cup? The menstrual cup is a flexible, reusable female hygiene product. Absolutely phenomenal. It lasts up to 6 to 12 hours, which is great, because that means that you only need to change this once a day. What that also means is that it holds 4 to 5 times more than your pad and your tampon. So it is extremely convenient. If we look at the advantages of this menstrual cup, number one, it is cost effective. So a cup will cost you from about 200 Rand for one cup. The cup will last you from 6 months up to 10 years, depending on how well you take care of the cup, which we'll talk about a little bit more. It is safe to use for the individual, it is environmentally friendly, and it is the most convenient device to use amongst all the other devices that we spoke about. So when I was speaking about the fact that it can last up to 10 years, it will obviously depend on how you take care of your cup. So if you boil your cup every time you use it, you'll be killing the germs, and you'll make sure that your cup lasts for a very, very long time. So who can use the menstrual cup? The menstrual cup can essentially be used by everyone except virgins. We do not encourage virgins to use the menstrual cup, because obviously we are worried about the integrity of your hymen at that time. Otherwise, everybody else can use the menstrual cup. The only thing you need to know is that you need to find out the length of your vagina. You need to know the shape of your vagina, and then you need to know the strength of your pelvic muscles. So if you have weak pelvic muscles, it can be very difficult for you to keep the device in. If your vagina is very long, you need to buy a menstrual cup that's a little bit longer than this, or that has a longer tip than this. If your vagina is quite stretched out, remember we said it's a muscular wall, you might need a bigger cup than this. So this cup that I'm holding is a small cup, it's a my size. If you have given vaginal birth, you probably need at least a medium. And if you're in the older category, heading towards menopause, you most likely need a large vaginal cup. The disadvantages of this cup is that it can be quite messy. I will show you the insertion and the removal of the cup. It can be difficult to use at the beginning. As you can imagine, you need to put this whole device inside you, as compared to the tampon. This whole thing needs to fit inside your vagina, which can be a little bit tricky, especially at the beginning. Those of you who are allergic to the materials that are used with the product, you can have problems with allergies with this product, and it can cause some vaginal irritation, especially if you do not wash your hands effectively before use. I think, however, if we look overall at these devices, I think we can all agree that this is the best device to use. And those of us who are doing pad drives, for people who are less fortunate, maybe we need to look into getting people menstrual cups, because these are more cost effective and they last a lot longer. I'm now going to show you the insertion of the menstrual cup. All right, so insertion of the menstrual cup. I love this little device. I think this is basically silicone. So essentially what you need to do is, this is the device. You need to fold it, push it down in the middle. You fold it again. So this is what it must look like when you're pushing it in. You come, you're in your squat position, or you have one leg up on the toilet, and then it's folded, and you push it inside your vaginal opening, inside your vagina. Go, 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 go. And then you release it. And when you release it, there's that pop sound that you need to hear when you release it, that tells you that the seal has been closed. So what you do then is you feel around it. There should be no indentation. It must be a complete full circle, which tells you that it's inserted well, right? Then it's in place and there's no issues. My cup is a bit long for my drawing. This should not be hanging out. It should be completely inside the vagina, and you must put your fingers inside the vagina to take it out. So when you are pulling this device out, you only pull on the edge, right? So this stick here at the end is what you pull on, right? The little tail. So you pull on the tail and then it comes out. Now you can imagine how this can become problematic, because what actually happens is you've got fluid in here, you've got blood, right? So imagine that this cup is filled with blood and you're pulling it out of your vagina from the tip. It can get a little bit messy. So it's important that if you're doing this for the first time, you're a beginner, make sure that all your clothes are off, because you don't want to stain your work clothes, and make sure that you are gentle and that you are careful. Once you pull it, the seal will pop once again, and when the seal pops, you know that it's out. Then you just pull it gently. If you are too aggressive, you're going to have blood spillages everywhere. And that is your menstrual cup. This is a lot of fluid, by the way. The menstrual cup can hold about 4 times more than the tampon and the pad. So if you ask me, this is indeed the future of menstruation. Thank you so much for watching this video. We hope that it was extremely informative for you and that you learned something new. We want to remind you to like, comment, subscribe, and of course, remember to share and join the notification gang. We love and we respect our notification gang. Remember to tag a friend, tag an auntie, tag a cousin, and definitely tag a sister. We will see you in 2 weeks with our next episode of Woman Crush Wednesday. In the meantime, I need you guys to comment in the sections below. Let me know if you've had any experiences with the devices that we spoke about, particularly the menstrual cup. Let us know how it's working for you. Let's engage, let's talk as ladies, and let's progress as a nation. Ladies and gentlemen, it's your favorite vaginologist, it's your favorite doctor, it's your favorite obstetrician, and it's your favorite gynecologist. Thanks for watching.